Canadians over the age of 75 will suffer from a leaky mitral valve.
In the past, that meant open heart surgery, but South Lake Regional Health Center is using a minimally invasive procedure to correct the problem. Our health reporter Pauline Chan explains.
The mitral valve is located in the heart.
It's supposed to allow blood to flow from the top chamber into the bottom chamber. It's supposed to close up so that it doesn't flow backward.
But when patients like Anthony Tesserolo develop a problem with that valve, like the inability to open fully, called stenosis, or to close properly, called regurgitation, it needs to be repaired.
Well, I started to notice palpitations, skipped beats, in about January of last year.
Traditional treatment for Tesserolo's regurgitation would involve open heart surgery, but Dr. Carolyn Tang at South Lake specializes in a much less invasive form.
And instead of sawing through bone, we can just go between the ribs, so we don't have to cut any bone at all.
The surgery itself lasts about 3 hours, and the patient is released just 4 days later.
Within the GTA, there are 5 hospitals that do cardiac surgery, and we're the only one that does this minimally invasive approach for the mitral valve.
Tesserolo had his surgery December 11th and spent a couple of weeks using pillows made by the volunteers to protect his side, but he's looking forward to returning to work soon.
I started a formal cardiac rehab program next week, and I'm walking a little bit more and more every day.
The thoracoscopic surgery involves less blood loss, less chance of infection, and the scars are barely visible. In the case of women, Dr. Tang can even hide the 2-inch incision in the breast crease. And while scarring may be the least of a patient's worries, Dr. Tang is sensitive to the long-term effects on her patients.
It only takes us a few hours to do what we do, right? But the scar that we make lasts a patient a lifetime.
Pauline Chan, CTV News.